So then let us know then about Ubunye Capital's reaction to the minister talking about the taxi industry coming second when it comes to, not second per se, but being included in the second phase of the vaccine rollout.
Yeah, I think it's a very welcome decision by the minister. I think if you're looking at the sheer magnitude that the taxi industry commands with regards to the movement of people in South Africa, it makes absolute sense. The healthcare workers board a taxi to get to work. Some metro police officers use a taxi to get to work. Bus drivers use a taxi to get to work. The ailing community and the poorest of the poor depend on a taxi. So on a daily basis, the taxi driver is in contact with a large number of the community. It makes absolute sense that taxi drivers are prioritized, and not even just taxi drivers alone, but the entire rank workforce is prioritized.
The marshals as well.
Yes.
Now, would you say that the taxi industry has actually been complying with the COVID-19 regulations that have been set out by government?
Yes, I think to a hugely large extent, the taxi industry has been complying. And I think in the beginning, when we went into a very hard lockdown, it was quite difficult to get the taxi industry to comply because there wasn't enough information. There was just fear. And if you are struggling with the fear of losing income and fear of a pandemic that you have absolutely no idea about, it then makes it difficult for you to comply to the rules. But as time went on and as more information was sent to the industry and there was more advocacy and education around COVID-19, we are actually seeing taxi drivers, taxi operators, even rank staff taking even the wearing of masks very seriously.
Would you say that you see that also applying with the long distance taxis as well? Because I know that when a long distance taxi has to take that journey, oftentimes they calculate into the fare of each passenger what it would cost to put petrol into the taxi and to pay toll gates for the duration of that journey.
Yes. I think precisely for the longer periods, for the extended periods, I think an MIT health study suggested that public transportation in its normal form, which is not what we see in South Africa, does not pose a super spreader opportunity, right? However, if you are looking at the amount of time people spend in a minibus for a long distance trip, that prolonged period of time in a confined space can actually cause the spread of the virus. So I think those drivers are even more cautious than the drivers that you see doing shorter distances. Yeah.
And just going back to the cost of actually complying with the rules, would you say that perhaps the cost of having to sanitize a taxi after every trip and also providing sanitizer to the passengers as well as the taxi drivers has actually increased their costs to the point where they might have to consider hiking up their fares?
I think what has happened, and I think we need to applaud particularly the Gauteng Department of Transport, which has actually assisted the minibus taxi industry with regards to the sanitization of vehicles. And I think we've also seen that in some of the larger metros in Cape Town as well as in Durban, where the different spheres of government have actually come in to assist to provide the sanitization equipment for those vehicles. But with regards to masks and just the normal ventilation, opening of windows in the taxi while the taxi is in motion, I think the drivers and even the commuters themselves have taken that up as their responsibility. So what we're seeing in the industry is literally I take care of myself, you take care of yourself, and we make sure that when we are in a taxi environment, we are taking care of each other. Yeah.
Now, considering the volumes of people that travel, using taxis on a daily basis, when we get to lower levels like level 1 and possibly actually have the lockdown restrictions removed completely, how can the taxi industry then avoid becoming a super spreader event going forward?
I think that point that you are raising is going to see the taxi industry moving even a bigger number of commuters with the current woes of PRASA and what is happening in the bus industry, we are seeing a lot more commuters coming into the taxi industry. But I think if we continue with the advocacy and the education with regards to masking up, as well as introducing a sanitization products that are not only supposed to last for a day, where taxi is supposed to be sanitized on a daily basis, but that last a bit longer, like nano seal sprays in taxis, then I do not envisage that the taxi industry would be a super spreader. Yeah.
And just lastly, speaking to the viewers who are watching who might be taxi owners, taxi drivers, as well as commuters, what would your words of encouragement be, especially when it comes to complying with the rules? Because sometimes you might find that a taxi driver wants to comply, but his boss who owns the taxi isn't willing to pay for, as much sanitizer as they require per day of work.
I do think that if we are going to have a taxi industry that is going to provide a quality service, specifically to a community that is the poorest of the poor, as business operators within the taxi industry, we have to absorb those costs that are going to ensure that we are providing a quality and safer service to the community. And I think if the taxi industry can focus on building what it has already started building, which is the customer centricity and really being community focused, I don't think that cost should be a cost that would be detrimental to the success of the business, but it would actually assist the industry in building a bigger pool of commuters. Yeah.
Thank you so much for joining us this afternoon, coming all the way. That was Ubunye Association's Vuyisile Majola.